All right, thanks for joining everybody. I'm Eric Bennett, founder and CEO of Frontier Bio. So we create human tissue to meet the demand of tissues globally. So only 10% of the global organ demand is met. There's 150,000 transplants per year worldwide. So our goal is to create organs to meet this demand and other tissues as well. We're going to be starting with blood vessels. We're generating revenue in the meantime towards this goal. So we can use our tissues and tissue engineering services with customers that are looking to move away from animal studies. So, oh, we're being live streamed. There we go. So yeah, 5.5 million in sales so far for disease modeling, medical device testing, etc. And so that itself is a large market while we work in the background towards our longer term goal of extending health span with creating implantable tissues and organs. Oh, and this 1 trillion comes from just the very high growth rate in this field, 35% year over year. Oh, and this was just an alternative slide. So just a little bit more about what we do. We use 3D bioprinting and other techniques to create tissues. And it's very difficult to create complex tissue. So I have this slide just showing how difficult it is. So or how complex real tissue is. If you look at the alveolar air sacs, it's just one cell thick, and the bronchial section has various cell types dispersed throughout the structure. And it's not just one cell type, there's a lot of different cells. There's ciliated cells with little hairs that move around, pushing mucus and debris around. So what we have done, I'm going to zoom in here on the left. We are using a mixture of 3D bioprinting and self-assembly. So what we do is we're printing stem cells into a hydrogel, and after some time, they start branching on their own, and they create their own alveolar air sacs. And so you can see here the fluorescent image of those alveolar air sacs sprouting out. And so what's crazy about this too is it creates mucus and surfactant. It also has cilia as well. You can see the cilia beating in unison. It's pretty crazy. And so some people call this 4D bioprinting, where it's 3D printed and changes over time. So this approach that we're taking is, rather than placing every single cell where they need to go, or rather than creating a acellular scaffold and seeding it with cells, we're getting the cells to create the structures and the function themselves. Because when we were embryos, back in the day when we were very young in the womb, our stem cells, already knew how to create every organ in the human body. So we're kind of replicating that process. Okay, we also do other tissues, not just lung, blood vessels, and neural tissue. And I have an example here. So with one customer, we have a $1.1 million contract with a customer where they are interested in traumatic brain injury, but they know that animal studies don't translate well to humans, and animal studies are cruel. So it involves hitting the animal in the head with an object or causing a blast, an explosion near the head of the animal, and then cutting it up, looking inside and looking at the damage. So it's pretty cruel, and doesn't translate well to humans. So this $1.1 million contract is partially for the research and development to create a chip based off technology that was developed at Stanford. We licensed it. So we're modifying it to work for this application. We will deliver tissues at the end of the project, and it will end in a supply agreement. So that's the 1.1 million. And the great thing with working with government, this is a government contract, is they're not interested in commercializing. So we're free to commercialize this technology that they're paying for with other customers like pharma. Just a quick background, since I'm running out of time. So I'm a serial entrepreneur. I was the CTO of Aether. Some of you may have heard of that company before. We created low-cost 3D bioprinters. I'm My background is biomedical engineering. Victoria created the world's first human brain organoids for studying epilepsy, and she won an international award for that work. And Sam has the most highly cited review paper for tissue-engineered vascular grafts. And then we're about 10 people right now. So we're raising 2 million. We raised 1.3 million so far in this 2 million round. Previously, we raised 2.5 million. And our most recent investment is from a Nobel Prize laureate, Jennifer Doudna. Okay, use of funds. We will use the funds for hiring a business development lead. At Frontier Bio right now, we are all technical scientists or engineers. So getting that business lead will really help accelerate our growth. We'll perform preclinical testing of our blood vessels. We're actually starting animal studies soon with Mayo Clinic. Our first animal studies will be at Mayo Clinic, and we'll get partnerships with pharma. The 5.5 million in sales so far is actually not with pharma. It's with medical device companies, government, other startups, neurotech companies as well. So that is it for me. I take
Fantastic.
questions in the chat.
Yeah, thank you, Eric.